Your cat could be dying right now. You don't even know it. Kidney failure kills 1 in 3 senior cats. And once it reaches the final stage, you have only 3 months on average. But there are ways to catch it earlier. Hey there. Today we're going to talk about the most dangerous disease affecting domestic cats, kidney failure. You'll learn how to recognize symptoms in the early stages, what your pet is actually feeling, and how to make the right decision when the critical moment comes. If you have a cat over 7 years old, this video could save their life. Let's get started. Most owners think that if their cat is eating and walking around, everything is fine. Kidney failure is the leading cause of death in senior cats. The disease develops over months and years without obvious symptoms. When the kidneys lose 75% of their function, the body starts poisoning itself. At the terminal stage, you have 3 months on average. But for some animals, this process takes weeks. For others, it stretches longer. If your cat is over 7 years old, get blood and urine tests every 6 months. Early detection gives you years of quality life. Owners think nausea in cats is just an upset stomach. When kidney function critically declines, nitrogenous waste products accumulate in the blood, urea, creatinine. This is called uremic syndrome. Imagine, the body literally poisons itself from the inside. What happens to the cat? Apathy, complete refusal to eat, constant nausea and vomiting. The mouth starts smelling like ammonia, like smelling salts. Painful ulcers appear in the mouth. If you notice an ammonia smell or mouth ulcers, this is an emergency situation. Immediate veterinary help is needed. Supportive therapy can temporarily relieve symptoms. Owners blame strange behavior on age or personality. Toxins and electrolyte imbalance damage the nervous system. The cat starts moving unsteadily, staggering. Tremors may appear, shaking in the paws or body. Sometimes seizures begin. Behavior changes. A calm cat becomes aggressive. An active one falls into apathy. In the most severe cases, uremic coma occurs. The animal stops responding to the outside world. Any neurological changes, unsteady gait, seizures, unusual aggression, require an urgent vet visit. This is a sign that the disease has gone far. Many don't pay attention to their pet's limb temperature. At the terminal stage, body temperature drops below normal. Touch the ears and paws, they become cold to the touch. This is a sign that the body can no longer maintain normal temperature. Breathing becomes shallow, intermittent. Mucous membranes dry out due to dehydration. The cat barely moves, doesn't respond to voice or touch. Cold extremities are a critical symptom. It means there's little time left. Discuss palliative care or euthanasia with your vet. Owners think the problem is only with the kidneys. At the final stage, a chain reaction launches throughout the body. The cardiovascular system works at its limit. Arrhythmias appear, blood pressure fluctuates. Anemia develops. Blood stops carrying enough oxygen. Due to water-salt balance disruption, the body retains fluid. Swelling appears. All this creates a vicious circle that accelerates decline. Comprehensive support, heart medications, anemia correction, edema control. This isn't treatment, but it can ease the condition. Owners try to force-feed their cat, making their condition worse. Constant nausea is one of the most agonizing symptoms. Toxins in the blood irritate the vomiting center in the brain. The cat may vomit several times a day. Fortunately, intensity can be reduced with medication. Antiemetics really help. But completely eliminating the symptom at the terminal stage is impossible. Don't force-feed. Use antiemetics as prescribed by your vet. Offer small portions of warm food with a strong smell. Pâtés, baby food. Owners think it's just fatigue. Weakness is caused by several factors at once: uremic intoxication, dehydration, anemia, and electrolyte imbalance. With severe exhaustion, it's physically painful for the animal to stand up. Muscles atrophy, joints hurt. Every movement requires tremendous effort. Provide a soft bed in a warm place. Put bowls nearby. Don't force movement, but gently change body position every few hours to avoid bed sores. It's believed that cats don't show pain. Cats are masters at hiding pain, but at the terminal stage, this becomes impossible. Pain is associated with mouth ulcers and gastrointestinal tract lesions. Many fear stomach ulcers, but in practice, clinically serious cases are less common than oral ulcers. Nevertheless, pain is present. Pain medications prescribed by a veterinarian. Soft food. Watch behavior. Here, if the cat sits hunched over, refuses water due to mouth pain. This is a signal to increase pain relief. People don't pay attention to the coat's appearance. Dull, unkempt fur isn't a small thing. It's a direct sign that the cat no longer has the strength to groom itself. Grooming requires energy, and when the body is fighting for life, this is the first thing it gives up. Gently brush the cat with a soft brush. This not only improves appearance, but provides pleasant contact. Wipe the fur with a damp cloth if the cat doesn't object. Owners don't know about electrolyte imbalance. In terminal kidney failure, potassium accumulates in the blood, hyperkalemia. This is critically dangerous for the heart. Excess potassium can cause fatal arrhythmia and cardiac arrest. This is one mechanism of natural death with this diagnosis. The heart simply stops beating due to electrolyte imbalance. Control electrolytes through blood tests. In a clinical setting, infusion therapy can be performed for correction. But at the terminal stage, this is a temporary measure. Owners hope the cat will fall asleep quietly and peacefully. At the terminal stage, death occurs from increasing uremia, critical electrolyte balance disorders, blood pressure drop, and temperature fall. Neurological symptoms don't appear in everyone. Some experience stupor, some seizures, some coma. There's no single scenario. The finale is rare agonal breaths and cardiac arrest. This process can take from several hours to several weeks, and it's not always peaceful. Talk openly with your vet about prognosis and options. Palliative care can ease the condition but won't prevent the finale. Owners consider euthanasia a betrayal. Many veterinarians view euthanasia as an ethical way to end suffering when therapy is powerless. The procedure is performed under deep anesthesia. The pet experiences neither pain nor fear. This is an incredibly difficult choice for the owner, but it gives the opportunity to stop the prolonged agony of a beloved creature. This is an act of love, not betrayal. Make the decision together with your veterinarian, based on an objective assessment of your pet's quality of life, not on your emotions. Owners wait too long, hoping for a miracle. There are 5 clear signals that it's time to discuss euthanasia. 1. The animal hasn't eaten or drunk for a long time. 2. Extreme degree of exhaustion. 3. Severe pain that isn't relieved by medications. 4. Continuous seizures. 5. Coma. The animal doesn't respond to external stimuli. These signals say the body no longer has the strength to fight. Don't wait for the last day. Discuss with your vet in advance which signs will mean it's time. Give yourself time to make a decision consciously, not in panic. Tests are only done when the cat is already sick. Kidney failure isn't always a death sentence if detected early. Timely treatment can extend life for years and preserve its quality. The problem is that symptoms appear when the kidneys have already lost most of their function. Tests show the problem much earlier. For cats over 7 years old, blood chemistry and urinalysis every 6 months. For cats over 10 years old, every 3 to 4 months. It's inexpensive and can save years of life. Owners prolong their pet's life at any cost. At the terminal stage, the main question isn't how long will they live, but how will they live this time? If every day is pain, nausea, weakness, and fear, that's not life. Palliative care can ease symptoms but not eliminate them completely. And here you need honesty with yourself. Assess quality of life objectively. There are quality of life checklists for animals. You can find them at your vet's office. If there are more bad days than good, it's time to make a decision. As you can see, everything in the body is interconnected. Kidneys affect the heart, toxins affect the brain, dehydration affects the entire body. Kidney failure isn't just a disease of one organ, it's a systemic catastrophe. But early detection, proper care, and readiness to make a difficult decision can change everything. Your care isn't just about treatment, but about knowing when to let go. Do you have a cat? When was the last time you did blood work? Write in the comments, I'll answer your questions. And definitely subscribe to the channel. In the next video, we'll break down how to properly feed a cat with kidney failure to maximize their lifespan. There will be specific food brands and recipes. Take care of your pets. See you in the next video.